Okay, sorry about that. I had the conference website up, so I was hearing duplicative sound, and that was on my end, and we are good to go. But I do want to address the comedy of the plug in and unplug kind of technique this morning, because that's definitely how I approach all technical things. But we're so excited to have you here. I hope you had a wonderful weekend, got an extra cup of coffee, and just to kind of contribute to the dialogue that was occurring in the chat, I'm coming from Reston, Virginia this morning. So again, happy to have you all here. This is the first session of a week-long conference with the HUD CARES Act Training Conference. This platform that you've joined this morning will be how you access all of the content throughout the event, and it gives you an opportunity to engage with the sessions, download session materials, and view all the sessions. The first 2 days are focused at CARES Act funded programming and being able to learn program applications and any other processes type content, and then it will transition into a basically CDBG curriculum for the final 3 days of this week, every day running from 9 to 6 p.m. Eastern with varying session times. To start off, want to make you feel empowered that you know how to use the technology that's available to you, and be able to interact with the platform and ask us questions and be able to get any technical issues resolved. So let's start going through those items. All PowerPoint presentations and the webinar recordings will be posted to the HUD Exchange after the conference. So you'll be able to access any of this content at a later date, as we normally do with any of the offerings that we provide to you guys. Participants have been added in a listen-only mode, so we can streamline the audio experience for you guys. Closed captions can be added by the show caption feature located underneath the video. Prior to today's session, you were emailed an attendee guide, and you can also access it on the resource page to get any other of these technical items addressed and referenced throughout the event. Questions can be submitted below the screen that you're viewing the presentation in. And we ask that you submit any content-related questions in the Q&A box. And then we'll work throughout the presentation to answer them and have a specific Q&A in today's session to address what we receive. For the chat, you can continue on the right side of the screen, which you guys were able to access this morning, add any technical issues or continue to introduce where you're coming from for today's session. There's also an email that's located on the screen, and you're able to email them directly if you have any further technical issues. Throughout our session, we have incorporated some polls that we will use to kind of seek understanding of our viewers and be able to customize kind of our language to your needs. And that's also in that scroll down a little bit underneath the video, you'll be able to access it. If you want to see all the slides at one time and not have to navigate the scroll down, you can use this additional platform service, which is what is embedded below this video. It's Slido. So if you go to the Slido website, there's a code that will be coming in the chat box now. And then there's also a code in the session description below that will allow you to view the Q&A and the polls that we're going to have throughout the session in a separate browser. And since this is the first session, noting that there's an opportunity to download it as an app if you're maybe not a multi-screen setup and you want to be able to access it on your phone to do that dual view. So I just want to again thank you for being here. We appreciate it. All the work that you're doing is incredible for your communities, and we're just sitting in this presentation to empower you and help guide you through the program requirements. So today's session will provide an overview of the admin policies and procedures, and we're going to contextualize it from kind of where we're all coming from, the history of the CV program, and then also what policies and procedures look like, what are those needed elements to be in compliance, what will help guide you, and on the really good structure, like the best case scenario for your policies and procedures. And then tying it back to key CDBG-CV elements, because the basics are the foundations for our policies and procedures. We'll follow up with kind of the next steps and orienting you to the training and oversight portion after your P&Ps are implemented, and then review some resources that we have available and address those questions that you guys have submitted throughout the presentation. So as a reminder, since this platform may be new to you, that's the below the screen or in that Slido website. So my name is Olivia Healy. I'm a community development analyst at ICF, and I will be joined today by my colleagues, Carrie Kronberg and Les Warner. We've worked closely with HUD in the development of resources and trainings and one-on-one technical assistance for grantees for the application of the CDBG-CV regulations. So as mentioned, kind of the first poll to kind of get to know you guys a bit better, we want to know the size of your Cdbg-CV allocation across all the rounds of your funding. So what's that lump sum that you guys have? And that poll functionality is located at the bottom of your screen, or again, in that additional platform on Slido. So be able to get that submitted. And it looks like the majority of you are following, it's a pretty close tie between C and D. So $1 million to $3 million and $3 to $10 million. And that keeps shifting, and you guys are able to see the results of that live. So getting into our session content, we are going to just kind of ground where we've come from to know where we're going and be able to navigate policies and procedures. So from a basic standpoint, the CDBG-CV curriculum or programming is based off of the normal CDBG programs that you guys implement. The funding for CV was implemented in 3 different grantee rounds, and grantees were required when the funding was released to understand all the nuanced differences between the normal program and the CV regulations. There were several alternatives and to speed up the process of implementing funding locally within your community through those flexibilities. Grantees have had to evaluate their community needs to understand the local impact. And grantees were required to apply for the funding that they received through the 3 grant rounds through a action plan amendment or including it in their 2020 action plan submission. HUD has gone through the process of granting action plan approval for all of the phases at once, or if you did the phased applications to get your round 1 funding and then applying for the second rounds of funding as you've been given them. And at this point, grantees are all past this program launch and into program implementation. The CV program, CDBG-CV program, requires this element of duplication of benefits that needs to be documented and managed throughout the life cycle of your programs. And we'll touch on this in more detail later on. But at large, this is an effort to make sure that any individual or project doesn't receive more funding than is needed for the same purpose, so there's no duplication of the benefits provided. As grantees begin to develop or identify projects in their local areas, they had to understand what activities were eligible. Thankfully, it was the basic CDBG eligible activity, so building off of that knowledge, but with this extra layered of preparing, preventing, and responding to the coronavirus. And I did mix up those 2 Ps, but prevent, prepare, and respond. And you'll often see this referred to as PPR as we move through this presentation and kind of at large in the industry. HUD has allowed several waivers and alternative requirements to provide additional flexibility in implementing these projects, getting funding to your communities at a faster rate. And these all of these elements will be touched on later in this presentation and kind of show you kind of how it ties back to the P&Ps to make it really feel applicable and give you actionable next steps after the presentation. You want to walk away with how can this be applied to me. So with the world forever changing, every day I feel like we're kind of thrown into a new mix and flexibilities. We need to understand at least where this program started in 2020. We were all forced to understand the program requirements, assess our community needs, and keep evaluating the local and national response to the coronavirus. This happened alongside internal capacity changes at your organization as the nation switched to work from home, and being able to implement things from a remote fashion and not have that one-on-one person interaction that we were all kind of forced to adapt with. The beginning required a lot of flexibility as numerous funding sources in response to COVID were released, and we needed to understand the difference in program eligibility across all those funding sources so we could create really effective programming within our local communities. The challenges. And the challenges is going to go much more focused on just Cdbg-CV, even though we've been required to understand what's happening kind of all around us. That's how we're really effective at creating this programming locally for our communities and leveraging the benefits of the Cdbg-CV funding. But the challenges that we're focused on today and the rest of this presentation is really geared at that Cdbg-CV focus. Across all the Cdbg-CV grantees, HUD has seen a variance in spending from minimal funds drawn to almost all of their funds being drawn. And where does this gap in our grantee pool come from? Is this ties back to the capacity and the comprehension of regulations and the flexibilities combined with your local community needs. There's also how much funding was received from other sources as well. Since Cdbg-CV is built off the regular CDBG program, which is something that can be seen as its strengths, if weaknesses did or were available or were present in your core CDBG program, that non-compliance issue is further implemented as you developed your Cdbg-CV program. Not all of the staff that were brought on board to implement the Cdbg-CV had a strong foundation in the CDBG curriculum, and new staff were added to kind of fill the capacity gaps as we moved through responding to and developing the programming from this funding source. And this is a few reasons why we've started to see programs not in compliance, and we want to transition into making everything in compliance. So the need is to really refocus on the Cdbg-CV policies and procedures. Policies and procedures are a key tool in ensuring compliance within your organization. And as you implement this programming through the Cdbg-CV funding, and to effectively establish P&Ps or adapt existing P&Ps to serve your programming, you really need to have a well-versed understanding in the requirements and exceptions that are in the Cdbg-CV programming. As for those of you that have already spent funding, maybe from round one, and then you're moving into additional rounds, developing documentation around the legacy of the first round of funding to be further implemented in future additional fundings to help bring your organization up to compliance. At this point, I'm going to invite my colleague Harry Kronberg online to begin talking us through the next steps needed with, or the importance of policies and procedures.
Great, thank you, Olivia. So yeah, jumping on the bandwagon of where we're coming from, I'm Carrie Kronberg, and I'm in the Portland, Oregon area, so it is still dark and it's very early here, but you know, lots of respect to people in Alaska. I don't know if I saw anyone from Hawaii, but if any of you are online, yeah, I've got nothing to complain about. And just very quickly before I dive in, I also want to acknowledge that, though ICF is presenting this session, it was and is a collaboration with LISC, or the Local Initiative Support Corporation. It's another technical assistance provider, but they really developed the idea. They had done some direct work with some grantees and identified that, consistent policies and procedures were a compliance issue. So just wanted to give a shout out to them and our thanks for developing the concept. Okay, so why should we have policies and procedures? Well, they're important because they are required. First of all, when HUD comes to monitor you, they're going to ask to see how you document that, what you're doing and how. And they're a communication tool, right? They give staff guidance on what they need to do, when, and how to do it. And they also ensure that we have an evaluation process in place to target funds towards the highest needs. And, if those needs change, then to refocus. And that's, something specific to Cdbg-CV because we're in an ever-changing and evolving environment. We need to have a policy in place to ensure that our funds are best meeting the community needs at the time. And then, as mentioned, they should be in place for HUD review and monitoring. They'll be looking for specific components in your policies and procedures. Okay, so format for your Cdbg-CV policies and procedures. There's no need to write a whole new policies and procedures manual from scratch. Although this is an opportunity to revisit your existing policies and identify gaps that are associated with the annual Cdbg program requirements. But there are significant differences between that annual program and Cdbg-CV. So you should augment your existing procedures. And that could be in the form of an addendum. That might be the most efficient approach, right? Just sort of talk about everything that's different in one document. You could add, Cdbg-CV specific elements to existing procedures. But in any case, the additional policies and procedures should address the necessary elements in a complete and concise manner. Okay, so as I just mentioned, when HUD prepares to come monitor you, they usually do a little bit of background work ahead of time. And I know we always got a request, send us your policies and procedures related to X program, right? And if you look at the Cdbg HUD monitoring exhibits, when they're looking at overall program management and financial management, they've identified these areas as things that they're specifically looking for. So we'll go through each of these in a little more detail over the next several slides, but just in general, this is what they mean. So how are you ensuring that the use of funds meets the program requirements? What's your policy to review proposed activities, make recommendations, and ensure that what you're funding is actually allowed? You should have a clear overall management structure and the roles within your organization and who holds responsibility. That should be identified. You should have a method to track your progress and outcomes. You should also have data collection methods to ensure that the decisions you make are data driven and that the outcomes measured are measured as required. Of course, record keeping. If anyone's been in a training with me, they've heard me say if it's not documented, it didn't happen. So record keeping, of course, is critical. And then finally, financial management. You have to have procedures to adequately manage your Cdbg funds, Cdbg-CV funds, and ensure all expenses are eligible. So I'll note, you don't have to structure your policies and procedures this way with a separate chapter for each of these. Some of these, financial management, record keeping, I think in a lot of program manuals, I've seen that those are standalone chapters. These are just the components that HUD is looking for. So there's overlap in some of these requirements. And so, how you address each of these will probably differ from one grantee to another, but these are components that you need to include that HUD is specifically looking for when they monitor, and helps to look at their monitoring forms, right? Looking at the test before, or the final exam before you get started. Okay, so to ensure program requirements are achieved, your procedures should include a description of how you solicit, review, and select Cdbg-CV activities. Given the need with Cdbg-CV to respond quickly and likely serve different populations than you might with your annual CDBG program, with different activities, you probably need to adjust your activity solicitation procedures. So we'll talk a little bit more about this when we go into eligible activities, but say a lot of places typically run an annual or a biannual application round. And that's not really compatible with the need to get funds out quickly. So you want to reconsider how and when you accept proposals or applications for activities. And then part of that activity selection should be ensuring that the things you do select, of course, meet a national objective with an eligible activity. And then specific to Cdbg-CV is the requirement that that activity prepares for, or responds to coronavirus, PPR tieback. And then, finally, if you select an activity that is eligible under a waiver or alternative requirement, or maybe has some flexibility applied to it because of a waiver or alternative requirement, document that as part of eligibility. And then finally, because Cdbg-CV is an emergency program governed by the Stafford Act, grantees have an obligation to prevent duplication of benefits. And it's a requirement that you have a duplication of benefits prevention procedure. Okay, overall management. So who's responsible and which roles, right, have responsibility associated with Cdbg-CV implementation. So you need to have this for the annual CDBG program, and it's no different for Cdbg-CV. So not only who is responsible for management and implementation of the program, you might have multiple roles associated with that, but also who's the day-to-day administrator, where does the buck stop, who is the primary point of contact or person responsible for administering the program. It doesn't have to be a person's name, it could be a role, right? You just want to identify who that is. And then also include, your procedures around monitoring and oversight of units of general local government, if you're a state, subrecipients and subgrantees. As I mentioned previously, you might be working with new partners on Cdbg-CV. So an important consideration is how are you going to adjust your monitoring practices to account for new partners and new activities? There might be some folks that are unfamiliar with CDBG funds, or even if they are familiar with CDBG, Cdbg-CV is different. So you probably want to get involved earlier in the process to spot check and monitor activities for compliance. So another policy and procedure HUD will look for when they monitor is how you're tracking your progress on your program and the activities that you funded. So what were your expected milestones and completion dates, or do you have, a policy and procedure in place that you're setting those, right? So that you can track your project progress. Also think about when and how might you change course. And we'll mention this a couple times, but it's important, right? Given you have tight expenditure timelines associated with Cdbg-CV, it's really important to stay on track with spending and ensure you don't lose access to any of your awards. So just as a reminder, you need to spend 80% of your grant within 3 years of the HUD's signature on your grant agreement, and then 100% within 6 years. So folks that were really on the ball and got their action plan amendment in early, they're coming up on just having a year left to spend their Cdbg-CV, or 80% of their Cdbg-CV. Okay, so as I mentioned on the overview slide of this section, decisions you make with your CDBG and Cdbg-CV need to be data driven. So data you collect can help you determine community needs, and then particularly with Cdbg-CV, help you reevaluate and pivot as those needs evolve. So that data should also help you track the location of activities that you fund, and ensure equitable geographic distribution. And then you need to track beneficiaries' demographics to report an IDIS as required. And then finally, your data collection policies need to ensure you're collecting and reporting consistently. So data that you provide when HUD monitors shouldn't differ from what they see in IDIS. Okay, record keeping. So you probably have an existing record keeping policy, not only for CDBG, but government, right? Government agencies have to have record keeping policies in place. So, other items to consider for Cdbg-CV related to record keeping are similar to ensuring that your activities are eligible, right? So in the eligibility portion, the focus is how you make those determinations. What's the process that you go through to determine that an activity is eligible? With record keeping here, how are you documenting that, right? How are you memorializing that the activities are in fact eligible? So, and additionally, some grantees may have still used paper processes and records prior to the first shutdown. I know places that I had worked were in kind of a transition from a paper to a digital storage process. And we transitioned very quickly to a virtual environment. I remember, a week before we shut down, I was like, what is this? What is this coronavirus thing? So it just happened. It felt like overnight. And as we have transitioned to that largely virtual environment, how have your record keeping policies and practices changed? How are you ensuring that all of the information you need is documented and stored in the right place consistently in your electronic files? And then finally, the last thing that HUD will be looking for is, of course, last but not least, financial management. So like record keeping, you probably do have an existing financial management policy and procedure. Some critical elements of that include procurement. So the Cdbg-CV implementing notice, it doesn't make significant changes to procurement requirements, but we've listed it here because it's a common area of concern. So especially in an environment where you have a lot of money and you're trying to get it out quickly, sometimes there's a temptation to sort of not follow procurement requirements to the letter, and that can be problematic. And I'll just give an anecdote. So I worked in Colorado for many years, and when we first got our CDBG DR funding, I went, this is how I think, I guess, I went and I read the OIG reports for other CDBG DR grantees. And just to see, okay, what are the common issues that OIG is finding that are coming up and maybe triggering repayment. And this was 8 or 9 years ago, but procurement sticks in my mind as the #1 thing that I saw. You didn't follow your own rules about procurement, and now you have to demonstrate that costs are reasonable, or you have to repay funds. So it's something critical. Ensure your procurement requirements are followed. And then like other activities, you want to track amounts budgeted for eligible activities. So obviously you want to ensure adherence to your budgets, but also as part of your progress tracking, this is some of that interconnectedness of these requirements, right? So if you're significantly underspent on something that you've budgeted for, or you're spending faster than you anticipated, you might want to revisit how you've budgeted those available funds. And then related to record keeping, you need to maintain documentation that expenses are eligible and detail that process that you go through to verify eligibility of costs that you're reimbursing. So typical receipts, invoices, et cetera. And then you also want to track progress of expending your Cdbg-CV funds overall, right? To ensure you'll be able to spend funds in accordance with those expenditure deadlines that we just talked about. Okay, so that's kind of right. That's what HUD is looking for when they monitor you generally. And we'll dig into some of these related to Cdbg-CV a little bit more. But before we do that, just, what are the steps to go through to sort of get where you need to go? So if you haven't already developed Cdbg-CV policies and procedures or augmented your existing procedures, here's what you want to do. So first, evaluate where you are. Do you understand generally the Cdbg-CV program requirements? And we'll give you some, a good starting point with this presentation on things to consider to add if you haven't addressed your policies and procedures. But make sure you understand what's different about Cdbg-CV and what's the same, right? What are the basic CDBG requirements? Additionally, do you understand, the operational functions needed to implement Cdbg-CV? So what needs to change about your organization and how you implement the program? Then take a look at your existing policies and procedures and determine what you need to add, augment, or revisit. And then finally, make a plan for how to do that. So who will work on these additional policies and procedures, and what's the timeline for completion? And maybe do some need attention earlier than others? Is there something that has an impact right now that we really need to address? So that's step one. And then, of course, next you need to develop those policies and procedures. So as mentioned, you can create a standalone document that just addresses the relevant areas that you need for Cdbg-CV. You could revise or addend your existing policies and procedures. So maybe you add something to the record keeping section, for instance, to accommodate Cdbg-CV requirements. Or, many of you, particularly states, may already have a special allocation such as Cdbg-DR. A lot of you also have CDBG or ESG-CV, excuse me. And there are some overlapping requirements between those programs. So you could include the Cdbg-CV policies and procedures with those if, say, you had standalone DR procedures. And then finally, you don't want to update your policies and procedures for Cdbg-CV and then have them sit on the proverbial shelf, right? You need to operationalize those. You need to communicate to your staff about what has changed and what are our policies and procedures around this program. So, identify who is impacted. Of course, that's going to be program staff, but then also, accounting staff might be impacted as well, particularly related to financial management. And then lastly, you just want to develop and implement a training plan to ensure that that everyone is trained and understands the policies. And I did just see a question come in about the spending requirements again. So 80% of your grant has to be spent within 3 years of HUD signing your grant agreement for Cdbg-CV, and 100% has to be spent within 6 years. And with that, I'll pause for a drink of water and pass it to Olivia for our next poll question.
Thanks, Carrie. So essentially, we just want to know where you guys are at, and that's what this poll question will capture. So either scroll down or jump into Silo and give this question an answer so we can begin to see where you guys are at. And that question looks like it's live now, if you guys were having a lag. So we have a good combination of yes, sort of, and no, and unsure. So I think this presentation, this presentation covers kind of all of these different phases that we're all in developing our admin policies and procedures and being able to deliver these programs locally. So if you haven't had an opportunity to answer the poll, make sure you do that. And then Carrie will be back online to go through these key Cdbg-CV elements. And as we continue to move through, as Carrie just was able to do, if there's any questions that you have as we're reviewing a certain slide, feel free to submit that question and we can try to answer in real time or at the end when we go through our Q&A portion. Thank you, guys.
Yeah, great. I'm really impressed and happy to see that, it looks like roughly a third of you did develop policies and procedures right away. I think, where we were with how crazy everything was at the time, wasn't necessarily at the top of everyone's mind. So kudos to you. Okay, so now we'll kind of talk about some of those key Cdbg-CV elements and how those relate and impact policies and procedures that you need. Okay, so first, of course, CDBG, the regular CDBG program kind of has that two-tier test, right? National objective with eligible activity. You need to meet those two things in order to have to be able to fund something. And Cdbg-CV adds this third component of there has to be a connection to the coronavirus, PPR tieback, as we affectionately call it. So how does the activity prevent, prepare for, and respond to the coronavirus? So not the first time we've mentioned it, but we want to dig in a little bit more. So the relationship between the activity and the pandemic will vary widely based on the specific impacts in your community that you decide to fund with Cdbg-CV. You have a lot of leeway here. And in some cases, the relationship to the pandemic might not be readily apparent to HUD or someone reviewing the file when they're monitoring in 3 years, right? So always document in the file how the projects and programs that you fund relate back to causes or effects of the spread of coronavirus. So focus on documented impacts or risks to the areas Cdbg-CV touches, housing, economic, and infrastructure that serves LMI communities in particular. So you can demonstrate PPR tieback through a direct effect. So for example, rehabilitating a building to create a quarantine and isolation rooms for recovering coronavirus patients, if it's part of a medical facility. But there also might be indirect effects. So maybe you're providing a small business assistance and they need, because they had social distancing measures and they need due to stay-at-home orders. Now they can't serve as many people, so they lose some of their cash flow, for instance. Okay, and then also think about looking both backward and forward. So what are the impacts of the pandemic that Cdbg-CV can alleviate or repair? So what has already happened? What are the impacts of what has happened? But also look forward. How can we improve our communities for, heaven forbid, the next pandemic? Or just to prevent the spread of viruses and disease. So HUD published guidance on this topic in April 2021. It's been a big question we've seen in a lot of the technical assistance we've provided is, how do I make this activity eligible? How do I tie it? And so there's some great guidance where they've provided numerous eligible activities as examples. So that can help, guide your thought process there. Okay, so just some examples again of PPR tieback. You could, as I mentioned, have direct or indirect impacts. Direct impacts will be more obvious, but you should still document your logic and require that you do that in your procedure. And then, as mentioned, indirect impacts might require a little bit more explanation. So say with this second one, you're upgrading a park to add more covered space. Well, if you just said that, that's not, how is that tied to coronavirus, right? That's not readily apparent. So go one step further in the explanation. We were trying to increase capacity for social distancing. Maybe this is adjacent to an area, maybe it's like a, plaza in the center of town and restaurants around it needed to use that space for some of their outdoor dining, for instance. So, other things, other examples include constructing a community health center or funding mobile pop-up stations to serve patients or as COVID testing facilities. It's more obvious, right? It's direct connection. A less obvious one might be upgrading an HVAC system in a childcare facility to improve air quality and minimize the spread of infectious disease and keep those kids safer. And then also just this last one, if you're rehabilitating a building, I think we have an example a little bit later about, say, a homeless shelter, if you're adding isolation rooms for quarantine, or maybe just so that folks who fall ill can isolate. Okay, so as part of your policies and procedures, you should explain how are you going to make determinations on whether a proposed activity will prevent, prepare, and respond to coronavirus. So, how are you going to get that information? If it were me, if I were implementing this, I think I might ask applicants when they're, proposing a type of activity, identify how that proposed activity is related to the pandemic, or if it's something that your agency is taking on yourself, make sure as you're developing the concept that you're clearly indicating how this is tied to coronavirus and how it will prevent, prepare for, and respond to it. And then, if it is coming from an outside party, from an applicant, as part of your internal review process, you could determine whether you agree with that. Does their logic make sense? Does it hold water? And then additionally, in your policy, you want to indicate who will be responsible to ensure that that determination is made and that the activity meets the PPR tieback requirement. So again, this doesn't have to be a name, but it could be a role. Someone should be ultimately responsible to say yes or no. And then include in your record keeping policies where you will document that you made the PPR determination. Would it be in the project review summary that your agency uses to evaluate applications for funding? That would make sense, right? If we're looking at eligibility of something, we also probably want to understand how it's tied to coronavirus. You might also include it in the word notification to the applicant, just to document to them, you agree, or you've confirmed how their proposed activity will meet that requirement. You might state it in your written agreement. When I worked on written agreements in Colorado, we explicitly stated the national objective and eligible activity. So it was very clear how we understood that this thing that we were funding was eligible. It would make sense then for them to add that relationship to the pandemic to memorialize the eligibility determination. Okay, duplication of benefits. It's a really important concept for Cdbg-CV, so we'll spend a few slides talking about what it is and how to ensure you have a compliant duplication of benefits procedure. So, duplication of benefits, it occurs when a recipient of Cdbg-CV funds or benefits receives financial assistance from multiple sources for the same purpose over the same period of time, and that total assistance exceeds the need. So basically it's double dipping. You could have a subrecipient, who's running a program. They could have a duplication of benefits if they get multiple sources to fund a CV related program and those sources exceed the funds needed to operate it. It could also happen with a beneficiary of Cdbg-CV assistance. And I think, that's commonly what we think of, when you consider the situations people found themselves in during the pandemic, say you worked at a restaurant, your income suddenly dried up, rent was coming due. If I were in that situation, I would probably apply for everything I could find, right? And then if multiple sources come through, those beneficiaries need to be aware that the assistance they receive can't exceed the need. And then, something to keep in mind too related to this is other sources of funding have become available throughout the pandemic. The emergency rental assistance program, I think, forced some Cdbg-CV grantees to adjust their plans to provide emergency rental assistance with Cdbg-CV. And now we have American Rescue Plan Act funds that may also be used for some of the same activities. So you just need to keep an eye on what other sources are out there that might be duplicative of Cdbg-CV funds. You're required, as mentioned, to establish and follow procedures to prevent DOB, duplication of benefits. And these policies apply to your CARES Act funding, as well as other formula funding. You were given some flexibilities with the 2019 and 2020 annual CDBG program funding associated with, you're able to use it for some of the same purposes as Cdbg-CV. So if that funding is used to address pandemic impacts, then duplication of benefits, that policy procedure would also apply. And then of course, all Cdbg-CV grantees are subject to the requirement. It's not different for states versus entitlements. Okay, so quickly, the process to determine whether a duplication of benefits occurred. It's a math problem. And the hardest part is probably gaining access to information that you need to document whether other sources are available or to make that determination. But this process that you go through, the result of it is, okay, this is the unmet need. So first you determine other sources that have been awarded or can be expected to be awarded to pay some or all of the cost for the same purpose and the same period of time. Then you'd subtract that other assistance from the total need and you'd end up with that unmet need. And of course, as part of your policy, you need to document that you went through this process. So, mentioned there are other sources of assistance. So you need to consider those and ask about them before you provide assistance to an applicant as either a subrecipient or say a beneficiary. And you need to have make a reasonable effort to determine what those other sources might be. So your policy should demonstrate that you're going to act reasonably to evaluate the need. And again, as I mentioned, this is the hard part, right? Getting the information about other sources of funding available or what other sources folks might have. So how do we act reasonably? You could maybe use data sharing agreements with other agencies administering COVID relief funding that might be duplicative and compare beneficiary lists to identify possible duplications. Or if your agency is administering another program in-house, such as ERAP, you could compare, for instance, addresses associated with assistance payments. And then in some cases, identifying other assistance may simply be asking applicants for other sources they've received or expect to receive, and require that they promise that they're telling the truth. They certified to what they've stated. And then something to keep in mind is some loans may or may not be considered duplicative assistance, depending on the source and type. So private loans, if someone gets a loan from a bank, that's not considered duplicative, but Small Business Administration and FEMA subsidized loans are typically counted towards the duplication of benefits, so they would be duplicative, but there are some exceptions. And if you want to know what those are, take a look. There's a duplication of benefits quick guide available on the HUD Exchange, and that talks about what those exceptions are. Okay, so you gather that information. As mentioned, the applicant should certify under penalty that they're providing complete information. And then also the policy should require that they sign an agreement that they understand that they will have to repay any duplicative assistance. This should be maybe something, if they're signing a long agreement, have it be something they initial. We don't want any confusion or anyone saying, I didn't know. So make it very clear, you can't have a duplication of benefits. And then, just to note, some folks, as mentioned, maybe states might have an existing duplication of benefits procedure, such as for CDBG DR. Can you go back, Olivia? Sorry, I'm just making that last bullet. Thanks. And, a note here, so the duplication of benefits requirements are very similar for DR and Cdbg-CV. But just to note, unlike other disaster funds, if you're administering Cdbg DR, you're probably familiar with the statutory order of assistance. That doesn't apply to Cdbg-CV. So grantees don't have to validate, the order or which other funding sources are available and should be spent first. It's really just ensuring that an actual duplication of benefits doesn't occur. Okay, so moving on from duplication of benefits, assessing and reassessing community needs. So typically as part of your annual CDBG program and other HUD grant programs, you take a look at your community needs and try to target funding towards those things. And that's no different for Cdbg-CV. You should use data, as we talked about earlier, to identify where the greatest need is and what the best uses of your Cdbg-CV funds are. But with COVID, we've seen that change rapidly. So major impacts have been on housing, the economy, education, and public health, of course. But how those impacts and the severity of them have really changed. So you need to, be regularly reevaluating how your Cdbg-CV funds can make the most impact. So, will there be a trigger maybe if a major program is way underspent and needs have maybe dried up? You need to revisit the community needs and pivot. So that's something that you need to build into your processes to assess. And something I would add is you should also consider the long-term impacts of COVID that Cdbg-CV can be used to mitigate. So something that comes to mind is the digital divide, right? And we saw how a lack of access to high-speed internet put underserved communities and children at a significant disadvantage in keeping up with their education. So you may want to target your funds towards something like that, right? Towards broadband to decrease that digital divide. Okay, financial management and deadlines, considerations for your policies and procedures. So just a few more details on the impacts to these procedures. Most of you are probably well beyond this point, but we'll quickly mention that the start date or the first date that Cdbg-CV funds could reimburse a cost was January 21st, 2020. So if that cost was preparing for, and responding to coronavirus, it could be reimbursed. You should establish as part of your financial management what your start date is. Again, probably past that. A note on program income. Cdbg-CV activities may generate program income, but if they do, it's treated as program income under the annual program. That may create timeliness implications, which is something to keep in mind, but you treat Cdbg-CV PI as you would annual Cdbg program income. And then planning and administrative costs, ensure that you track how you use these funds so you don't exceed what you're allowed to spend on planning, administration, and technical assistance. And we're going to talk about state-specific requirements in just a moment, but states have a higher cap than the annual program, so should account for that. And again, I'll just reiterate procurement and the importance of following those, your existing procedures to ensure costs are necessary and reasonable and contracts are awarded fairly. And then we've mentioned this a little bit, but tracking expenditures is important. Remember that timeliness under the annual program is waived. We're looking at different requirements here for expenditures. I'll say it one more time. Ensure your progress tracking and financial management procedures account for that abbreviated timeline, especially to spend 80% of funds in 3 years. Okay, and then just a few notes for my state friends. So HUD included a few state-specific requirements and flexibilities in the implementation notice to expedite the use of Cdbg-CV funds and ensure that non-entitlement units of general local government still had access to Cdbg-CV. So states are allowed to act directly, meaning they don't have to award funds only to non-entitlement units of general local government. So that means they can use staff or provide funds directly to subrecipients or subgrantees. States can also provide funds for activities in entitlement areas and then tribal areas, of course, with agreement from the tribal entity. To ensure that non-entitlement UGLUGs have access to Cdbg-CV funds, there's a non-entitlement set aside. So the amount of that first CV1 tranche, states have to award to non-entitlement units of general local government. It didn't have to be that money, but across the grant, that's the minimum amount that needs to go to non-entitlement UGLUGs. And then additionally, states have access to a higher cap on administrative and technical assistance funds, as well as no match requirements. So states can use up to 5% of their Cdbg-CV grant for state administrative costs and up to 2% for TA. And then the remainder of that 20% can be used for UGLUG administrative and technical assistance costs. So how would that impact a state's policies and procedures? It would, of course, impact project selection and awarding funds. So, need to ensure that there's a method to award that minimum set aside to non-entitlement UGLUGs. So whether that's a method of distribution or a competitive process. And then also, states typically don't use regular CDBG in entitlement communities or tribal areas. So what's your policy and procedure on how you will do that? And then, of course, just the financial management procedure and ensuring that, you acknowledge that the administration and TA caps are a little bit looser, but keep track of how you'll achieve compliance. So now I'm going to pass it back to Olivia for our third poll, and then Les Werner will pick it up from there.
Thanks, Carrie. So as this poll question gets launched, we want to know what eligible activities you guys are funding. So going through the options here, select all that apply. And it looks like the option is just you can select one. So maybe pick the project area or eligible activity area that is receiving the most funding for your program. So it looks like the majority of, I guess, the biggest area. I know it's not capturing everything that you guys are funding, but definitely in the public service realm. Housing related, public improvements and facility. It's good to see kind of the widespread of project areas. As Carrie mentioned, we're going to transition the presentation over to Les. And he will be able to provide more of that CDBG-CV context and background to the program. So
right.
Les, the floor is all yours.
Thanks, Olivia. So I'm going to kind of keep us moving at a little bit of a clip since we got a little bit of a late start here. But one of the key things to keep in mind is just like if you were working with your regular CDBG allocation, you're always going to have an eligible activity and meet a national objective. So we're going to talk a little bit about some of the additional flexibilities, some additional alternative requirements that have been put in place for CV. So, for those of you that are not familiar with CDBG, attending the sessions that are going to be the training on the CDBG basics would be really important for you, because all of those rules are going to apply for what you're doing here. All right, so let's talk a little bit about, this is sort of our list here. We're going to be talking about each of these flexibilities. So we'll just jump into those. So the first flexibility that we want to talk about is just a reminder, essentially, on the overall LMI benefit. So the CDBG requirements are that the focus or the goal of these funds is about creating decent housing, suitable living environments, viable communities. But the key here is that it's going to be principally for persons of low or moderate income. And so we have an existing requirement under CDBG that does apply for CV, that at least 70% of the funds are utilized meeting a national objective that is for low and moderate income benefit. So that does apply for your CV funding, and it is calculated separately. So it's not that it's your CDBG funds and your CV together, and then we're going to run those percentages. It does need to be separately for CV. So as you're making funding decisions, or if you were at some point perhaps doing reallocation, where you had folks that said, I want to move some money from doing one thing to doing something else, you have to keep in mind that you're going to have to meet that 70% on that. So I think most people are kind of conservative and fund or direct more of their funds than the 70%, so that they're going to ensure that they will not have an issue in meeting that requirement. All right, so let's talk about LMI Jobs. So we have a couple of presumptions that are within the regular CDBG regulations, which, so when we are documenting LMI benefit, we typically are going to be getting documentation about that worker who is getting this new position, because we need to make sure that at least 51% of those individuals that have been in a job that was created or retained are going to qualify as low or moderate income. So we have a few shortcuts that were in the regulations which allow you to make some presumptions. And so those have been a little extra flexibility. In the past, you could not use the central business district without a higher level of poverty rate. So for qualifying census tracts that include the central business district, they have to either meet the 70% LMI requirements or a 20% poverty rate and evidence of poverty and general distress. Under regular CDBG, it would be 30% poverty rate would be the requirement on that. The other thing that's been done that is really kind of a major streamlining on this is that instead of looking at each of those workers and calculating their income based on them being part of a family, we're going to treat them as individuals. So we can look just at their income and compare that to the one person household regulations to determine whether they're going to be income eligible or not. So we don't have to then track down that information, the rest of the information about family size, other sources of income that are coming in. So one of the ways that we could streamline that documentation would be able to document the type of job that they are holding and the annual salary for that position, since we don't have to document the rest of those family members as part of that. All right, let's talk about urgent needs. So if we were looking at a chart of our national objective, we have our LMI, which we know we have to have at least 70% of our funds spent in that way. We also have slum and blight. And then our third one, which is really the least used normally, is urgent need. And so because we have, the pandemic, this might be a time when folks will be thinking about using urgent need as the national objective, but a couple of things to keep in mind. First of all, we just reminded you that at least 70% of your funding have to be spent in conjunction with meeting an LMI national objective. And so you have a limit on how much urgent need you could use overall. But there are, within the requirements for urgent need, there is 3 tests that essentially have to be met. So when you're looking at urgent need, and if you, there you go. Those tests are, first of all, we have to make sure that it is of a recent nature. We also have to make sure that it is something that is going to, trying to see, does the condition pose a serious and imminent threat to health and welfare of the community? And then our third test is about whether the grantee has other funds that are available for them to be able to meet those needs. So if you look to the Federal Register notice, and actually the page number for this is page number 51465 within that Federal Register notice. They give you really clear information on that. So for our first criteria about is it alleviating an existing condition, if your funds are being documented, which they have to be, to show that they are tracking with the prevent, prepare, or respond, that is going to be adequate to meet that first criteria. And then for our second criteria about does the condition pose a serious or imminent threat, the notice gives us 3 options there, referring to the public health emergency declaration that was made, and specifically they give you the link right to the press release in that. Also the president's declaration, and then thirdly, I think a reference to the Emergency Assistance Act with Stafford. So you've got very clear, easy criteria to be able to put in place. And then for the third criteria about having adequate other funding, you have to be able to show that there's not other funding available. As part of this, you're required to establish that you don't have a duplication of benefit. And so there's some language right in the notice which essentially directs you on how to put that document in place. So let's look at a few examples of eligible activities and talk through some of the implications on that. So first off, let's talk about procedures for soliciting activity proposals. And Carrie mentioned this early on, that we're doing lots of activities that we probably traditionally haven't done in the past. Carrie mentioned also that states who typically have to fund all of their funding directly to a unit of general local government, that we have a waiver on a portion of that. So thinking about who's going to be contacted, who are those potential partners to work on implementing some of these activities, we may need to think about expanding that outreach and then thinking about the appropriate system on this. So, for a lot of our regular CDBG programs, we're very used to doing a competitive process where everybody has to apply at the same time, and then we, vet those to select some folks. Maybe we need to think about doing, an open window on some of this. Think about the flexibility and what's going to work on that. And then think about expanding that, the outreach that you're doing when you're issuing that RFP to look at potential service providers that you may not have worked with in the past. And again, for policies and procedures, that has some implications when you begin to work with new partners who may not be familiar with some of the requirements, the documentation, what your process is going to be. So at the end of this, we're going to be talking about training and getting the word out, and probably your policies and procedures are going to be important with those other partners to think about, how am I going to work with them? What do we expect them to do? Timing, how are we going to communicate? All of that. And of course, we're going to be updating written agreements to outline some of those details, but those policies and procedures can be really helpful both internally and externally. All right, so let's talk about eligible activities. So things we need to think about, we mentioned they all need to meet a national objective. And so we have to determine that at the point we are funding them. And if that documentation is already available, that would be part of the file, or it's going to be tracked and captured as that project moves forward. We also always need to be able to show that linkage with prevent, prepare, and respond. And then also, are we serving LMI folks? So within our policies and procedures, we need to think about where we have some additional flexibility that has changed some of those requirements. We may need to update those sections. Also thinking about what your process is going to be for reviewing and documenting whether that project is going to meet or has met that national objective. Making sure that we have appropriate narrative within our applications to make sure that that linkage with prepare, prevent, and respond is there. We mentioned about jobs being created for LMI applicants, and our process on has been streamlined or could be streamlined for making that. So thinking about how we change our process, how we communicate that flexibility. And then making sure to meet a national objective for LMI on most of our area-wide projects, we're going to have to ensure that we hit that 51% of LMI where that area is documented under census information. And so having those procedures in place to capture that documentation as part of our decision-making process becomes really critical. All right, so for our eligible activities, we're going to look at a couple of samples on this and talk through some of the implications. So a lot of you are using money for emergency payments, and with our additional flexibility for CV, instead of being capped at 3 months of emergency assistance, which is what CDBG would require, the waiver allows us to go to 6 consecutive months. And so there was some additional clarification that was provided early on this to, as we are counting that 6 months of assistance, that time period is from when that first payment is made. So when we make that first payment, we could pay for whatever existing arrearages that household had, and then assist with up to an additional 5 months of assistance. So that's a change from what folks originally thought when they were calculating and thinking, well, if I'm paying rent for June, July, August, September, and October, that I would only have, I'm limited to 6 months of that rental period. It's based on that payment. And then moving forward. So one of the things to think about is your program's going to need to define how those periods of assistance are tracked and calculated to make sure that you're going to be in compliance with this. And then also really determining what are going to be the allowable things that you're going to pay for. One of our requirements is the payments need to be made directly to the provider. So some of you are going to have systems that will require that each one of those vendors would have to be set up within your system. So thinking through that processing portion on that. And then I'll just mention that for folks that are assisting with emergency rental assistance, we have this issue if we have pre-1978 units, that the lead-safe housing rule has essentially a waiver of the visual inspection for assistance up to 100 days. So this timing about that first payment being the start of that period, we need to make sure that we are documenting that so we show that we are within that waiver of having to do a visual lead-based paint inspection. And if we were doing those inspections, then we would have to then also address any issues that were discovered in doing that. So really important on that. And of course, duplication of benefit is an important part of our emergency payment programs. Let's switch gears and talk a little bit about economic development. And I'll mention that there are additional guides for many of our activities, and I would really recommend that you take a look at those for more detailed information. So many of our economic development projects specifically are required to do a public benefit test, and it's essentially a cap on how much assistance can be provided, and it's on either a per job or a goods and service versus population. So for CV, then there's under normal CDBG, there would be both an aggregate test and also an individual test. So the aggregate test for CV has been eliminated, and the individual test then has been modified. So we have 3 options on this. We would need to either be able to show that the cost per job doesn't exceed $85,000, or we could look at a goods and service. So if we were funding for a business that served an LMI service area, we would have to look at the goods versus for LMI individuals versus our investment. But our third option here, and in when it could be applied, would certainly be most streamlined would be if we are able to document that assistance being provided to the business is based on disruption of service, disruption of their business related to the coronavirus, then we essentially have met that public benefit standard. So thinking about, what's your process going to be in collecting and reviewing that individual public benefit test. As part of that, you may want to, in your policies and procedures, call out what you expect to have in place, what your review process is going to be, particularly if you have subrecipients and others who are going to be operating these activities on your behalf. It'll be really important to communicate that. All right, so then let's switch gears again and talk about the underwriting requirements on this. So we, and this is a standard as part of our economic development for CDBG, that there are some evaluation underwriting processes that need to be in place. And it's really looking to see, are all the funds committed? Is this reasonable? And so we need to make sure that we have a process in place for that. There is standard underwriting requirements there in 24 CFR Appendix A, which provides guidelines and objectives for evaluating project costs and financial requirements. So we need to take those and incorporate those into our process. For some of you that may not have been doing economic development in the past, you don't have a system already in place, so you may need to think about creating a loan review committee or a process to do this. You might have some loan committees that are being used for other things, such as if you're doing multifamily housing and you've got a loan committee. If you have a specific underwriting checklist, you may be able to use that committee to go through those, review those, and then give a, yes, this is approved, or a no-go on that. And so thinking about how that process will be handled and when that documentation and that decision process will take place would be an important adaptation to your policies and procedures. All right, let's talk about public service. So under our our regular CDBG program, we have a public service cap in place of 15%, which really limits how much grantees are able to use of their overall funds for public service. So luckily for the CV funding, that cap has been waived. There is no limitation on that. It also was waived for 2019 and 2020 CDBG activities when they are used to prepare, prevent, or respond to coronavirus. So we're going to need to have a tracking on this to make sure that we can show that documentation. And of course, you're going to need to be separating out, particularly for the 2019-2020 public service activities, which of those are under this waiver and are activities that are related to prevent, prepare, and respond. And so you may need to modify what your procedures are based on this new flexibility that's in place. Let's look at a couple of examples. So in this example, we have a homeless shelter, and they are trying to figure out, how do we protect our residents in this congregate setting from the spread of coronavirus? So they're proposing to do things such as, constructing partial walls, upgrading their ventilation system, and then also thinking about an isolation area when they have residents that become sick. And so these are eligible costs. We can meet a national objective of limited clientele. For when we are serving homeless individuals, they are part of our presumed LMI, so we don't actually have to try to calculate and track each of their individual incomes. But keep in mind that things like labor standards, all the other cross-cutting requirements, including Section 3, may apply to this project. So we need to make sure that we have all of those incorporated into our process. All right. Let's next look at an infrastructure project. So in this case, the community is wanting to install broadband infrastructure to serve an unserved LMI community. Particularly important with, telehealth, with children, in remote schooling. And so eligible costs in this project include the wiring, the fiber optic cables that are being provided, and then also equipment such as receivers that would be needed for then households to be able to access that broadband access. So if we can document that area, that this is an area benefit, so we'd have to define our service area and then document through the census information to show that that area is going to be at least 51% LMI, this can be an eligible project. And I'll just mention there's a broadband quick guide, provides several examples of eligible CV infrastructure projects that are for broadband. And so I would reference that as a good resource for you. And again, keep in mind, we've got these cross-cutting requirements, environmental review, Davis-Bacon, Section 3, that are going to be triggered by this project. So we need to keep those in mind as part of our policies and procedures. All right, so let's go to our next poll question. Livia?
Thanks, Les. This is our final poll question for our session today. So just wanted to kind of understand everyone's assessment of the current regulations and the flexibilities associated with them. So feel free to submit your answers for that now. So as the responses are coming in, it looks like there is the majority is sitting at the general understanding, and then we have some individuals with strong and then some individuals with weak. And that's kind of the whole point of this conference this week, is to further build your comprehension of the concepts and be able to apply it to different programmatic designs and serving your communities. As we transition back to the presentation here, we're at a point in time where this is going to be the training and oversight. Les and Carrie have illustrated the steps needed to implement and enhance your policies and procedures. From a key takeaway point, we have that 3 steps at the beginning where you evaluate your current policies and procedures. You augment them or adapt what you already have to add in the points that have been illustrated throughout today. And then that 3rd step being this training and oversight element. So that's kind of the full circle of our concepts illustrated today. For the training part, you want to identify the different functions and offices that'll be engaged in your Cdbg-CV program, and make sure that all of those internal checkpoints are included in the training, and they understand the differences in the program policies and procedures as it relates to the Cdbg-CV funding. So this could include grants management group, financial management, procurement, and procurement was that big point that Carrie kept going back to as an area where we common find mistakes amongst grantees. Establishing the training materials, if that's a guide that reads through your policies and procedures that you've developed, or a presentation, and then identifying the right person within your organization to do that training, and establishing a training schedule. This will make sure that everyone is aware of the opportunities available to them and can plan to attend and get that curriculum based. Outside of your internal functions and offices, make sure your subrecipients know what's going on, and anybody else that you are contracting out for these requirements. Carrie had illustrated some ideas earlier in contract agreements, making sure that they sign to show understanding of what they'll be held accountable to, and having points like that built into your curriculum to just ensure understanding and make everyone in compliance throughout your program. this is the end of our content for today, and we're going to provide you some quick resources and then use the remaining time that we have available to address some of the questions that you guys have submitted during the Q&A. If there's a question you haven't got the opportunity to submit yet because you've been listening to content, right now would be a good time to get that submitted, and we'll get right to those in a second. Throughout our, oh yeah. I'm sorry. So there's an audio on the last slide, and I don't know if you guys could hear it, or if I didn't, that's the pause that just occurred. I'm just going to move past it just in case it's just a voice in my head and it's not for you guys. But the tool that I was showing is also linked on this screen. It's the Cdbg-CV Toolkit. And this is all of the TA providers that are working with HUD to implement Cdbg-CV guidance for you guys have worked to illustrate quick guides and organize all the information so it's easily accessed and navigated by all of you. We also have on the HUD Exchange, all the CV information is located. That's a webinar archive is located on there, where you can find previous training that's done to date, and additional resources that we've pulled out that were linked earlier in today's session. And if you need contact information for any of the presenters today, this is our contact information, and it will be included in the materials afterwards. And I will now invite Les and Carrie to come back on screen to address some of the Q&As that we had.
Great. So while I know you were responding to questions while I was presenting, and vice versa, Les.
Right.
But one came up, and I think it would be good to touch on just for rental arrears and mortgage arrears, the lead requirements. So there was some confusion about, are we required to test? When is that requirement triggered, or is it a test, or what is it? Can you clarify what those requirements are around?
Yes. So
lead?
The lead safe housing rule allows, there's a waiver essentially of the visual inspection for assistance that is just up to 100 days. So when we first were talking about, well, we could be providing up to 6 months of assistance, then the thought was, oh, we're going to have to do visual inspections of each of those units, thinking about how would we arrange to have that done, but also a requirement under the lead safe housing rule when we do the visual inspection, if we found that we had a unit that had lead hazards, we would need to be addressing those. So with this clarification about the counting on this, the way we are counting that 100 days is from the date of our initial payment of our rental assistance, which I think for a lot of folks, you would be, on that first day, you oftentimes are paying for some amount of arrearage that is already in place. And then we talked about the fact that you could provide up to 6 months of additional assistance. So if let's say our payment date is June 1st, the first payment that we made, we have 100 days from that June 1st date that we would not be required to implement the lead safe housing rule requirement of doing a visual inspection of that unit. If our assistance goes beyond 100 days from June 1st, then we do have the lead safe housing rule requirement. Now, keep in mind there are a few exceptions on this. The lead safe housing rule, you would be exempt if that unit was a 1978 or more recent construction. So in some areas, a lot of your rental housing is going to be more modern than that and be exempt from this rule. We also, if we have housing that is restricted to the elderly only, not just that we have an elderly person living in a unit, but that these are restricted to elderly, those also can be exempted. I will just reference to learn more about the lead safe housing rule. There is on the HUD Exchange and on HUD.gov, there's a recent series of trainings that are posted there. And I would encourage you, if this is all new to you, that you may need to start looking at those. Carrie, are there other ones you want to hit on in our time?
Yeah, I think there was one that was exciting because we're also working on home ARP technical assistance, and someone had asked if you could use Cdbg-CV and home ARP together in an eligible project, and I did respond in the chat. But yes, if you as long as the requirements of each associated program are met, right? So theoretically, say you need a non-congregate shelter to allow for social distancing of people experiencing homelessness. Theoretically, you could acquire that with Cdbg-CV and maybe cover some of the supportive services with home ARP or vice versa. Okay, there were some general sort of questions about whether the presentation will be available. Yes, this is being recorded and will be on the internet in perpetuity. So it will be available, as will the slides. Okay, now a lot of questions are coming in. Les, do you see any that you want to answer?
Well, yes, one just scrolled by. So there was a question about for LMJ, and we mentioned that for jobs under LMJ, we're going to be looking at that individual income versus a family income. So it has streamlined it. So I did talk about the fact that we could look at their position and the salary. So that's the job that they're being hired into. In the past, we would have looked at what their income was the day that they applied. But in this streamlined option, we have the ability to simply look at what their rate of pay is going to be and be able to declare that as an LMJ job. There's a question about different LMI standards for non-entitlement applicants. As a former state person, I know both sets of regulations. There is some additional flexibility in the state regulations, but essentially the safe harbor for the LMI standards are the same for both states and non-entitlement and entitlement regulations.
I think that question, you may have addressed it in the chat, Les, but about duplication of benefits, whether we just need to do that once or throughout. That needs to be for every activity or beneficiary that is receiving funding or benefit. So it's not something that you could look at it, say if you were looking at a subrecipient's application for funding, you could do that analysis, right? You could ask as part of that application whether there were other sources that they were applying for the same purpose, and do the calculation at that point. But you do also need to follow up and monitor on that and have sort of a reasonable risk-based policy associated with checking for duplication of benefits on the back end.
And Carrie, there's a question here about they were told in earlier webinars that if they were making utility or rental payments, they needed to determine if essentially this would be maintainable for that household if they cleared their arrearage. I don't believe that that's a regulation. It's a best practice
right. And
on that.
Yeah, it's part of the necessary and reasonable test, right? You want to look at, does someone, if are we hopefully not just prolonging the inevitable, right? If someone is unable to pick up paying their rent after the assistance period ends, it may not have been reasonable to assist them. I hate the thought of that, but you need to have, someone needs to demonstrate that they have the ability to continue to pay, or that there are other sources available to support them.
And we have a lot of temporary unemployment that has happened related to this, but we also have multiple sources out there. So I think that complicates that a little bit.
Yeah. I think, in thinking through this after HUD came out with the guidance on, that the clock starts the date of the first payment, a thought that I had would be that it would make sense to use Cdbg-CV rental assistance for, say, a household that did have that happen, right? They had a temporary job loss and loss of income that, maybe then was coming back, and they just needed help covering that arrearage, right? So a bartender, right, who was out of work for several months, but then when bars opened again, and hopefully when they do again in the future, folks were able to start earning again, but didn't have that lump sum payment to cover their arrearage. That made sense to me because it could be a one and done payment. You assist them, and then they're able to pick up from there once that arrearage is covered.
And I think, Carrie, within some of the posted materials, I think there is a guide on this, and also there have been some prior webinar presentations on emergency payments that folks will find helpful on thinking about that.
Right. I think if there's any other questions you're dying to respond to, Les, please go for it. Oh, do you want to explain the difference between a policy and a procedure?
Well, I mean, really, your policy is kind of setting a standard in place, but then the procedure is laying out, how do we implement that? What steps will we take to ensure that we are going to be in compliance with that policy? And I would just reiterate that, Olivia talked about training. I've seen lots of folks that had great policies and procedures that were written by somebody, but the rest of the folks weren't necessarily aware of them or following them, or they didn't have a procedure that really laid out, how are we going to implement this? So your procedures are really that sort of implementation plan for what the policies, decisions that you've made and put in place.
Yep, great.
Looks like that brings us just past our allotted time.
So yeah, we'll say thank you to everyone who attended. Thanks to HUD for hosting, and thanks to CIDM for problem solving there at the beginning. All right, enjoy the conference.
Thanks, everybody.